Hello, my people. Welcome to GOC Grace channel today. It's been long we met here. Pardon me, please. You can take control of your health and well-being by taking a minute pause to look at some conditions that affect our bodies. Today, we will talk about chlamydia. Chlamydia is one of the most common sexually transmitted infections STIs worldwide, caused by the bacterium Chlamydia trachomatis. It affects both men and women and can lead to serious reproductive and general health complications if left untreated. Because many people with chlamydia are asymptomatic, the infection often goes undiagnosed, making regular screening essential for sexually active individuals. Causes and transmission. Chlamydia is caused by the bacterium Chlamydia trachomatis. It is transmitted primarily through 1. Vaginal, anal, or oral sex with an infected partner. 2. Genital contact with infected secretions or mucous membranes. 3. From an infected mother to her baby during childbirth, can lead to pneumonia or eye infections in newborns. Risk factors for chlamydia include having multiple sexual partners, inconsistent or incorrect condom use, previous or coexisting STIs, being sexually active and under age 25. Symptoms. Chlamydia is often called a silent infection because the majority of infected individuals do not experience noticeable symptoms, especially in the early stages. When symptoms do occur, they may appear within 1-3 weeks of exposure. In women, abnormal vaginal discharge may be yellowish with a strong odor, burning sensation during urination, lower abdominal pain, pain during sex, bleeding between periods or after sex, cervicitis, inflammation of the cervix. In men, discharge from the penis, usually white, cloudy, or watery, burning sensation during urination, pain and swelling in one or both testicles less common, burning or itching around the opening of the penis. Rectal infection in both genders. Rectal pain, discharge, bleeding. Complications. Untreated chlamydia can lead to severe health problems, especially in women. In women, pelvic inflammatory disease (PID), a serious infection of the reproductive organs that can cause chronic pain, infertility, or ectopic pregnancy. Infertility due to scarring of the fallopian tubes, chronic pelvic pain. In men, epididymitis, inflammation of the epididymis, that can cause pain and rarely infertility. Reactive arthritis, a form of inflammatory arthritis affecting the joints, eyes, and urethra, also called Reiter's syndrome. In newborns, conjunctivitis, eye infection, pneumonia, low birth weight or preterm delivery. Diagnosis. Chlamydia is typically diagnosed through nucleic acid amplification tests (NATs). These are the most accurate tests and can be performed on urine samples or swabs, cervical, vaginal, urethral, throat, or rectal. Cell culture or antigen testing, less commonly used due to lower sensitivity. Routine screening is recommended for sexually active women under 25 years, older women with risk factors, for example, new or multiple partners, men who have sex with men MSM, pregnant women usually during their first prenatal visit. Treatment. Chlamydia is easily treatable with antibiotics. The most common regimens include doxycycline 100 mg orally twice a day for 7 days. First-line treatment, azithromycin 1 gram orally in a single dose. Alternative treatment, NB self-medication is not advisable. Patients are advised to abstain from sexual activity for 7 days. After completing treatment, inform and treat all recent sexual partners within the last 60 days. Prevention. Preventing chlamydia involves practicing safe sex and routine testing. Use condoms consistently and correctly. Limit number of sexual partners. Get regular STI screenings, especially if under 25 or with new or multiple partners. Communicate openly with partners about sexual health. Abstain or delay sexual activity until both partners are tested. Public health impact. Chlamydia represents a significant public health issue due to its high prevalence, especially among adolescents and young adults, its potential for long-term reproductive harm, its role in facilitating the transmission of HIV. Conclusion: chlamydia is a common, yet preventable and treatable STI because it often presents with no symptoms. Regular screening, especially among high-risk groups, is vital. Left untreated, chlamydia can have serious health consequences, particularly affecting reproductive health. Through education, testing, treatment, and responsible sexual behavior, chlamydia infections can be effectively managed and reduced in the population. Always remember to ask for help and support when you're struggling with any health condition. If you need additional information, don't hesitate to ask.